Food, more than any other factor, is the strongest social determinant of health.
What we eat and don't eat establishes the basis for our health and impacts whether or not we're going to experience certain health outcomes.
Food and Friends was founded on the belief that anyone can get sick and that everyone can help. We deliver medically tailored meals to the homes of people who are living with serious illnesses. We've taken what we've learned from our experience working in the HIV community and extended it to a lot of other groups of people who are living with serious illnesses. Just earlier this year, we expanded our services to take care of people living with end-stage renal disease, congestive heart failure, COPD, MS, ALS, and Parkinson's disease.
It's not just for people who have AIDS, but also people living with cancer, now diabetes, and the newly added Bright Start program for women who are pregnant. That just opened up a whole window.
AmeriHealth Caritas, District of Columbia, has a wonderful partnership with Food and Friends. The partnership is built on the wonderful reputation that the organization has. And so in this partnership, our moms-to-be, and their families receive meals delivered right to their door.
So in this area, this is where we package all of our prepared foods. Typically, we do between 700 and 850 meals per day. This year, we will be serving over 1 million meals. And we could not do all of this without thousands of volunteers every year.
Our services are completely free. Both the meals and the nutrition counseling are at no cost. We want to be there for anyone who's no longer able to cook on their own, regardless of what their financial situation was like before they got sick.
March 23rd, 2016, I was diagnosed with breast cancer, metastatic to my bones, which leaked to my spine. I had to have reconstructive surgery. I had to learn how to walk, I had to learn how to breathe, I had to learn how to decipher right from left. I got scared. I was very afraid, and I felt like I was just by myself.
You hear residents saying, well, I don't know if they have food that they can take with their medication, or maybe they're deciding whether to buy food or to take their pills. And what I love about Food and Friends is Food and Friends looks at the family unit, recognizing that giving food to one individual is not going to be enough.
I think the most unique thing about Food and Friends is that this service truly is unique for each person who receives it. Food and Friends has 11 different meal plans that we offer, and a client can be on a combination of up to 3 of any of those. We can combine all 3 of them in order to design a plan that gets them exactly what they need.
So the social worker came in and she said, well, good morning, Miss Washington, how are you? We have this wonderful company named Food and Friends, and they will help you along the way. So Food and Friends came to my home and they sat with me and they went through all of the information on what days are good for you, what foods are good for you.
I actually think that the social component of what we provide has as much of an impact on our clients' well-being as the meals do.
What Food and Friends does is a great fit with our overall strategy to serve our members. So we want members to have low barrier access to what they need to be healthy and to thrive. And so having meals delivered straight to their homes and having that ability to interact with the nutritionist who helps to think about them in a whole person way is awesome and really aligns with our mission.
We all recognize kindness, love, being talked to with respect in a way that respects the dignity, and that's what Food and Friends does. Oh my God, to the moon and back.
Food and Friends has been very good to me and my family. Some days it's rainy, some days it's, cold, but just to know that they're gonna be there to deliver that positive energy. Everybody has the same spirit, and I just love that about Food and Friends. They are awesome. They are awesome.